Hello and welcome to my Dr. Nan's live show, and I'm here to discuss about superficial fungus infection. Um, Actually, in this kind of weather, a lot of my patients have complaints about rash and itch, which is ring shaped and it's spreading tight, and it's really continuous since 1 year, 6 months, or 3 months. And they have been tried a lot of drugs, over the counter drugs, like directly from the pharmacy shop, and they have not been able to get relief. So I request all my patients and all the people who are actually suffering from fungus infection that it's very difficult to treat fungal cases, so don't try to treat yourself and go directly to the pharmacy. Just try to consult a nearby consultant, dermatologist, skin doctors, skin specialist, and then only take the prescribed oral as well as creams, which will be easily available in your nearby medical shops. So when you see there's a rash, there's itch, there's circular form, spreading type, some kind of scaly rash too, that color, and it's itching, it's uncomfortable between your thighs, on your armpits, on your neck, on your body and hands and face, just try to consult a dermatologist. And you can consult me also online. I'm always available during this pandemic crisis. You can search me on this tab, Dr. Nandita Rai, cosmetic dermatologist in Siliguri region. And other seasonal infections that come across during this kind of monsoon season is, of course, acne eruption. Acne vulgaris is what they call it. It's not only prevalent in the teenagers, but it's prevalent in adults too, adult acne. So that time, don't actually take a lot of antibiotics. Don't take a lot of treatments in the parlors, in the salons. It's very bad because it can make your acne reaction more worse, especially if you put a lot of makeup and a lot of fats are going on to your acne and to make your skin look much better and different. I think better than going to that ads, you must visit your nearby consultant, dermatologist, skin specialist, and you can consult me also. I'm always available online during this pandemic crisis, and you can WhatsApp me on 906-4727-221, and you can show me your pics, you can discuss on the phone, and you can actually make easy online payments, which are not that costly, and you can just get even free consultations for your skin problems. So what is acne? Acne is kind of a blocked pores due to a lot of androgynous hormonal production, where your oil secretion, sebum glands get blocked and inflamed, and your pores are blocked, and then you get a lot of comedones, even open and close. We call it blackheads, whiteheads, what we call in common terms, and we treat that with a lot of creams that comes in the market. But I think it's better to take prescriptional isotretinoin capsules, creams, according to dermatologist, not by your own wish, but you have to consult a dermatologist because there are a lot of side effects. You can even have, if you're pregnant, you can even have a lot of complications. So it's better to consult a dermatologist before using these creams. And there are other antibiotic gels, creams, which you have to take under the prescription of dermatologist, skin specialist, because those can become resistant and you can never get better results. There are a lot of cosmetic treatments also, like chemical peels, which you can go through. So other infections that comes across during this pandemic time is also what is known as, staying at home. You have developed a lot of skin disease before, like psoriasis, like in Planus, and due to pandemic crisis, you have to stay home, and your skin is not getting enough light, enough vitamins, enough environment to keep it, healthy. So that time, this psoriasis and lichen planus, which are scaly, silvery scales, flaking skin. You must consult your nearby dermatologist once again, and apply a lot of steroid-based creams. Even you have to take steroid-based oral medications, which you have to actually prefer a good skin specialist, experienced skin specialist. Okay, and if you need like light therapy for vitiligos and a lot of other conditions, it's better to consult a dermatologist, skin specialist, and take a great advice. That will be coming up in my other videos. We have another seasonal skin problems, that is melasma, that is pigmentation, skin problem, like skin pigmentation problems. It's better to stay indoors this pandemic reason, but when you take sunlight, just wear a great sunscreen, especially for people who are in the hilly regions. Should wear good SPF, like above 50, 60, in gel form if you have oily skin, and if you have good normal skin, then you can prefer lotion or creams according to your skin type. And of course, you can use a lot of kojic acid creams, arbituric acid creams, which you can always use only by the prescription of dermatologist. Otherwise, you will create a lot of dry skin and other side effects. Maybe you can have red eye too. A lot of other complications can occur. So it's better to take specialist advice And always search me on just dial, Siliguri area Dr. Nandita, cosmetic dermatologist, and you can even WhatsApp me 906 4727 and then find your solution. So it's better, to stay home this pandemic crisis. But if you have emergency, then you need to wear mask and sanitizer. You have to carry on and stay at a space of, you know, 2 to 4 feet, or actually it's 6 feet. But try to stay as much as far you can in the crowded areas. Maintain social distancing, avoid crowds, meetings, and social gatherings. So that's how you can actually have a great, um, you know. Great solution for your better future and have a great skin. So I'll be updating a lot of tips, and my last tip for dry skin is like you just take a lot of water, have vitamin E and C orally if you can, or you can even have vitamin D orally, and then you can take sunscreen, and also moisturized sunscreens are also available. Also there are a lot of moisturizers which are for sensitive skin. You can take those and try it on, and you have to know your skin, is it dry or oily. So for oily you have to use mostly gel based, and for dry you can use lotions, and for normal you can use cream, whatever suits you. Okay, so just be careful while dealing with skin treatments, and avoid going to parlor and salon right now for skin treatments, because it's pandemic season, and it's better to visit first skin specialist, and then you can take the advice and carry on with your decisions. So have a great day. Take care. Ciao.